I think it's easy to not think about emergency services until you're the one that needs it.
Somewhere in the neighborhood of almost half of our services aren't able to respond 24/7 like they're required to.
And when you're looking at our area geographically, there aren't very many straight roads.
It's 45, 50 minutes before you're receiving any type of advanced level care.
Most of our services up here are volunteer services. So when you get a call, they have to get out of their bed, go to the station, get into an ambulance or a fire truck, and then go to the call.
The state has standards that ambulance services have to meet, and they require towns to provide ambulance services. There was no way we were complying with all of those standards in terms of response times and etc. So that was a really important impetus to get us to do what we have to do.
This is kind of an unusual regionalization because you're taking 4 independent services who are all volunteer and pushing them into one service with 2 full-time staffed ambulances. I'm James Small. I'm the Rural EMS Outreach Program Manager. I'm based out of the Wisconsin Office of Rural Health, which is located at the University of Wisconsin School of Medicine and Public Health. Providing EMS service is an extremely complex system to put together, particularly at a local, small town, governmental level. What we're doing is moving that discussion away from the gossip, rumors, and folklore of the community and moving it into objective data where they can make a good, logical, rational decision that they can stand behind.
The big change is we went from a single volunteer service model to we now essentially have a tiered response ALS. And so advanced life support. We established 2 full-time crews. Each ambulance is staffed with a paramedic and at minimum an EMT partner. So every call that we go on is bringing that paramedic level care to the patient. The quicker we can get intervention to a person can make a big difference in their overall outcome. With his experience and in essentially establishing a district up here that really there's not an existing model, so we were kind of writing the book as we went. And James Small offered that expert advice from years of experience and involvement with the Office of Rural Health, was able to help us overcome barriers or questions or where do we go from here. I couldn't be more proud of the 4 communities here that identified and followed through with that sacrifice to really support a strong EMS system, knowing that when they call 911 in their time of the need, the Northwoods EMS district and the volunteers will be there.